Man, 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 man. Social work isn't a profession. Public health isn't a real field. Your degree doesn't matter. Those aren't hot takes. Those are warning signs. Because every time society decides a field isn't professional, funding disappears, salaries drop, and the people doing the hardest work, typically crisis work, community work, prevention work, they get pushed to the margins. And here's the part nobody wants to say out loud. Calling a field non professional is just a polite way of saying the people in it shouldn't be taken seriously. This conversation isn't new, it's the same hierarchy that says empathy is easy, that caring is natural, and that the labor of women and black and brown communities should be both expected and unpaid. This is Equity Matters, and we present to you Respeck on my name. We got work to do. You are listening to Equity Matters, where we champion equity in every conversation. I'm your host, Dr. James Bell, and I believe storytelling is one of our greatest interventions. Stories honor the work, the people, and the labor that keep our communities alive, even when it goes unseen. And that's exactly what we're talking about today. The people keeping the fire alive in our communities, whether those are social workers, public health professionals, caregivers, the labor that sustains us and protects us that is too often undervalued and dismissed. I was listening to the Hip Hop Social Work podcast not too long ago with the homie Christopher Scott and Dr. Maria Wright. And I remember hearing about how there's this ongoing conversation around what it means to be professional or who gets to be called a professional. And the question is like, whose expertise do we trust? Or whose labor do we value enough to pay for? And today we see the labor and the lives behind all of that. And so I've noticed the social media commentary about professionals and professional degrees. People are asking if social work and public health are real professions. They're starting to question the value of our degrees, the training, and the expertise. But I want you to listen closely. Like, come here, come here. The question isn't about degrees at all. It's about whose labor we see and whose work we deem worthy of pay and respect. When we dismiss these professions, it's not just semantics because it has real consequences. Fewer resources, lower pay, less recognition for the people who keep our communities healthy and thriving. And every time someone says that's not a real profession, they're deciding whose expertise counts and whose doesn't. And so to understand why someone might question whether social work or public health are real professions, we have to look back at history and the idea of what counts as a profession, who gets to wear that title, and whose labor is recognized. Surprise, none of this has ever been neutral. In the late 19th and 20th centuries, professions were being codified in America. You had traits like formal education, hierarchical structures, licensure, and even punctuality were celebrated as markers of professionalism. But these traits were rooted in power, in whiteness, in wealth, and in maleness. People of color, women, and working class folks were often excluded, not because they lacked the skill, but because society didn't want them in positions of authority or decision making. So take early social work. Early pioneers of the field, like the settlement movement reformers, were often white middle class women. They shaped the profession around their own worldview, sometimes claiming to uplift poor communities because systematically excluded black leaders. They shaped the profession around their own worldview, sometimes claiming to uplift the poor communities, but systematically excluding black leaders and practitioners. Black social workers had to form separate associations to advocate for themselves and their communities, even as they were doing the same work, often in more challenging circumstances. And public health tells a similar story. Black and brown professionals were frequently restricted from leadership roles, even while they were on the front lines protecting communities from disease and disaster. And it wasn't just about race, gender shaped value too. Fields dominated by women, like social work, nursing, and community health, were essential but undervalued, underpaid, and typically dismissed as less professional. And we also have to talk about this idea of professionalism because it didn't fall out of the sky. It was built and engineered. The earliest professions, law, medicine, theology, they were gate kept by white wealthy men who believed that only they had the intellect, the discipline, and the moral authority to make decisions for everybody else. They wrote the rules. They decided what counted as expertise. They defined professionalism as themselves. But here's the trick: professionalism wasn't just about skills, it was about culture, about who spoke the right way, who dressed the right way, who moved through the world the right way. Professionalism became a code, a pass or fail system where the closer you were to whiteness, to maleness, and to middle class norms, the more professional you were considered. And the further you were from that norm, the more you were told to fix yourself, to assimilate, to smooth out your rough edges, and more or less to hide your truth to fit into somebody else's blueprint. And then there's the whole degree conversation that I've been tracking too. This the long game of legitimacy. Let's be real for a minute. And somebody could say I'm hypocritical because I have a doctorate, but advanced degrees were never just about knowledge. They were about access. They were about social capital and building walls around opportunity and calling them the standards. Because I want to name my own position in this. I have advanced degrees. I've walked the halls, I've sat in the classrooms, I survived the exams, I earned the letters behind my name, and that is a form of privilege. It's a real one. But those degrees don't make me smarter than the folks who came before me or the folks standing beside me. They don't make me any more committed to justice. And they definitely don't make my lived experience more valid than anyone else's. Because degrees, they can open doors, yes, but lived experience builds the house. Lived experience shapes the wisdom and the insight, and it teaches nuance and compassion. So when I talk about the politics of professionalism and professionalization, I'm not saying the degrees don't matter. I'm saying they're not the whole story, and they never have been. And if we start valuing credentials more than community, or maybe even theory more than truth, then we risk losing the plot. But even with all that said, the real issue isn't individual experience, it's actually structural power. Because you can have all the wisdom in the world, all the degrees in the world, and still work in a field that wasn't designed to hold power in the first place. When a field lacks structural power, it's not about intelligence or impact. It's about who controls the levers, who got the money, who's telling the narrative. Professions with structural power usually control a revenue stream. So in medicine, they have billing codes. The law has retainers. Business has capital. Well, social work and public health were funded through budgets that someone else approves. Our labor is treated as a cost, not as a generator. And when your work doesn't translate into profit, people feel comfortable undervaluing it. And so here's the truth we don't say out loud enough. Most social workers and most public health professionals don't generate revenue. We prevent loss. We're not a billable service. We're a line item that leaders are always trying to shrink, stretch, or optimize. We bring human outcomes. We bring community stability. We bring prevention and safety and things that you can't swipe a card for. The systems that we work in weren't built to reward prevention, they reward crisis. A heart attack gets paid for. A hospital stay gets paid for. An emergency response gets paid for. But helping a kid avoid foster care or supporting a family before eviction, how about stopping an overdose before it happens or reducing a community's trauma load? Those don't show up as dollars gained. They show up as dollars not lost. And in a capitalist system, not losing money is never going to be valued like making money. And that's why budgets cut us first. That's why our departments have to hustle for grants. That's why our workforce is burnt out. We are always doing life-saving work with whatever's left. And so, speaking of our workforce is typically treated like interchangeable labor, like bodies, not expertise. It's warm hands, right? And not trained minds. In systems with real structural power, people are seen as assets. You invest in them, you protect them, you keep them. But in social work and public health, we're treated like the workforce is endlessly replaceable. You burn one out, you hire the next. You lose one, you post a vacancy. You got people leaving in waves. And it's not because they're uncommitted, but because the system was designed without them in mind. And instead of trying to fix the conditions, leaders, myself sometimes included, shrug and say, oh, that's just the field. Organizations don't fund development to help people rise, they fund training to keep the ship from sinking. It's crisis management disguised as professional development. We ask social workers and public health professionals to hold trauma and communities and grief and crises, but rarely do systems ask who holds them. You can have an MSW with 20 years of clinical expertise or an MPH with deep community epidemiology experience, and a system will treat you like anybody with a pulse can do this job. That would never happen in medicine or law or engineering because those fields have structural power. They have scarcity narratives. They have gatekeeping. They have social prestige built into the job description. But when a field is feminized or when it's racialized or when its value is rooted in care instead of capital, America treats the workforce as disposable. Now, here's my biggest issue, and this is why this would appear on Equity Matters. When a profession doesn't control its own narrative, somebody else will write it for you, and they usually get it wrong. For social work and public health, the story has been shaped by people who have never sat with the grieving family, who have never knocked on a door with a wellness kit, who's never held community pain in their hands or their hearts at 2 a.m. Instead, the story gets written by folks who only see the paperwork and the budget line or the crisis headline on the evening news. And that's how you get the caricatures and the stereotypes. Oh, the social worker who just wants to take kids away, or the public health department that only shows up when something's on fire. The degree you get when you don't know what you want to do next. Those aren't accidents. These are narratives that were constructed and they stuck. If you don't control the story, you don't control the value. And for generations, our story has been told by everybody but us. Social work gets reduced to case managers, the folks who take the kids, the ones who just hand out resources. In public health, we get flattened to the people who put up the posters or the COVID people, the ones who make recommendations that leaders ignore. Never mind the epidemiology or the crisis response, the emergency preparedness, the systems work, the grief work, the policy work, the life or death decision making, because the public don't see that part. That's what happens when a profession lacks structural power. Your expertise is real, but your public image is optional. Every time someone outside the field says social work isn't a profession or public health isn't a profession, what they're really saying is we don't see how essential you are because we haven't allowed you to tell your own story. Professional identity isn't just built in the classroom, it's built in the culture. And if you don't control the culture, you don't control the respect. Because here's the truth: you can do the work and still be invisible, you can save the lives and still be dismissed, and you can carry the communities and still be questioned. And that's the cost of not owning your own narrative. So, where do we go from here? How do we take back something that's been defined for us, that's been controlled by others, and has been used to gatekeep the very work that we do? We reclaim professionalism by rewriting the rules, not the old rules, not the ones that reward whiteness and wealth and bureaucracy. We define professionalism on our own terms, on the terms of service, of care, of expertise, and impact. Professionalism is not just a degree, it's not a title, it's literally the fire that we carry. It's the labor that we do and the lives that we touch. When we name our work and when we hold our knowledge, when we insist and demand on being seen and respected, that's professionalism. We reclaim the narrative by telling our stories, by centering lived experience, by refusing to let someone else decide what counts as expert and what counts as skilled and what counts as professional. We reclaim structural power by organizing, by advocating, by demanding equity, by showing the world our work matters, our labor matters, our expertise matters. And yes, we keep pushing, we keep showing up, we keep carrying a fire, because professionalism is not something that's handed down, it's something that we take, it's something that we claim, and we live every single day. Professionalism can't just be about degrees. Degrees matter, but when they're weaponized to gatekeep opportunity, we have to fight back. We claim the fire by showing the world that our work, our knowledge, and our labor, it all counts. All of it. Also, I can't end this episode without pointing out, these standards of punctuality and hierarchy and objectivity. It sounds neutral on the surface, but in reality, they are hallmarks of white supremacy culture that's been baked into our institutions. They were never meant to evaluate skill or impact alone. They're literally there to maintain control and to gatekeep power. And it results in privileging some voices over others. This is a reflection of a deeper set of values, a set of standards that have been reshaped by history, by power, by who's always been allowed to define what counts as work, who counts as the expert, and ultimately who counts as being worthy of respect. So, as we celebrate this National Social Work Month, I want you to keep in mind and remember no one can tell you who you are. In the narratives that have been shared about you, it is our responsibility to disrupt them. We don't let these things go on long term. And this has been Equity Matters, because equity always matters.